Okay, hello, it's Dr. Buford. We're just getting started on your right knee. This is the medial compartment. We've got a shaver coming in. You can see some of the arthritic changes in the compartment. Again, this is the inside part of the knee. Here's a little area in the tibial plateau where the cartilage is a bit loose. Okay, hold the camera just for a minute. I'm trying to focus a little bit for us. There we go. Okay, I'm going to see how much we can get into the back of this compartment, knowing that it's going to be tight. Table down just a little bit, please. Okay, great. Okay, so what I'm really looking for, like we talked about, is loose pieces. They're not going to be in this compartment, I don't think, but we're still looking. Okay. The central part of the knee right here is where the cruciate ligaments are. Okay. And now in this lateral compartment, we're going to see that you've got no cartilage at all. See that? This is what true loss of cartilage looks like. This is bone right here below the shaver. This is cartilage on the periphery at the far edge. But we can also see here that the bone is completely exposed in this lateral compartment. Okay, so not much to do about that at this point. You can look at the femoral condyle up above and see something very similar, just exposed bone here. There's the popliteus tendon. And I just don't want to leave anything that could turn into a loose piece since we're here to get loose pieces out. Okay, so we've got any potential loose pieces of cartilage resected back here. And now we're going to look in the patellofemoral joint up in this region. And here we can see, we're going to see a bunch of loose bodies here, including some larger ones. So we'll get to work taking out some of these. There's one of them right there. See that big thing? So I'll put in the shaver. You can see it coming in with a little bit of suction. The truly loose pieces that are small will come right to the shaver. A big piece like that, we're going to have to probably take out and excise it. So we'll get to work on that. Okay, so I'm looking from the medial side. That big piece here that's been causing all these problems is right here. And we're going to go ahead and start our shaver and get to work on it. Sometimes it's soft and we can debride it just with a shaver. Other times we need a burr, so we'll have a burr ready to go also. But I think this is going to be the most important thing we do here today, given our limited goals here, is just to get this piece out so it's not clicking and causing all this pain. Okay, so what we're showing you here is our burr working on this loose piece. So by breaking it into smaller pieces, we don't have to make any big incisions. Sometimes if the piece is small enough, we can take it out intact, but this piece is way too big for that. So my first goal is to try and not make a big incision if I can avoid it. And this seems to be working pretty well as long as we're patient here. Okay, we'll show you some more in a little bit. Okay, so now we've got these pieces cut down to size, so to speak, so I can take this one out without a problem. There it is there. We'll get a good hold on it. And now that we've got it, we can take it out of the knee. Okay. We'll put our shaver and make sure there's nothing else that's bony here. Okay, so it looks like we need our shaver next. Okay, so that big piece was sitting right in here and it's completely gone. Now I'm just using this cautery device because it was very vascular. It had created a pretty significant inflammatory reaction, and taking it out, you can see, has led to some little bit of bleeding that we've stopped already. But that piece was all through here. Your patella, just for reference, your patella is over here. That piece was way over here on the lateral aspect. I can't tell if that's separate or part of the patella. We're going to investigate this next. It looks like it's pretty solidly part of the patella. So we got a little more work to do. I just want to show you our progress at this point. Okay, so let me see that real quick. We're all done here. I just wanted to show you where we're at. That piece used to be right in this region here. There are several other pieces that we've taken out as well. But for the most part, we've got this knee, giving it a quick tune-up like we talked about, mostly to get that big loose piece out of the way. So you still got spurs, you still have arthritis like we talked about, but I'm hoping that will significantly decrease your pain because you won't have something clicking in your knee every time you take a step. So good luck to you now. I really hope this does the trick for you, okay? Bye-bye.